Hello, I am Diana, a radiography master's degree student. Today, I will talk about the organs at risk in radiotherapy. By the end of this presentation, you should be able to define what organs at risk are and understand why protecting them is essential in radiotherapy. We will also briefly look at the potential consequences when dose limits are exceeded. Organs at risk, or ORs, are normal tissues that are sensitive to radiation and are located close to the treatment area. Because of their sensitivity, radiation exposure can lead to functional damage. Therefore, in radiotherapy, it is not only important to treat the tumor, but also to protect these surrounding structures. Radiotherapy is always a balance between treating the tumor and protecting normal tissue. As we know, radiation is not selective, it affects both tumor and normal tissue. Organs at risk have a limited tolerance to radiation, and exceeding this can lead to complications. Therefore, radiotherapy always involves balancing effective tumor treatment with minimizing damage to healthy tissue. Before treatment planning, organs at risk must be accurately contoured on imaging. This is typically done using CT, and sometimes MRI for better soft tissue definition. Standardized guidelines are used to ensure consistency between clinicians. Accurate contouring is essential, as it directly affects dose calculation and evaluation. The effect of radiation on normal tissues depends on the dose delivered. As the dose increases, the risk of complications also increases. Each organ has a tolerance limit, beyond which the probability of damage rises significantly. This is why dose must be carefully controlled during treatment planning. There is no completely safe dose, only a balance of acceptable risk. Organs at risk can be classified as serial or parallel. In serial organs, damage to even a small part can affect the entire organ function. In parallel organs, function depends on how much volume is irradiated. This distinction is important when evaluating dose distribution. The spinal cord is a classic example of a serial organ. This means that damage to even a small area can affect the entire function of the organ. It has a very low tolerance to radiation compared to many other tissues. If the tolerance dose is exceeded, it may lead to radiation-induced myelopathy, which is a serious and often irreversible condition. The lungs are an example of a parallel organ. This means that their function depends on how much of the organ is irradiated. If a small volume receives a high dose, the organ may still function normally. However, as the irradiated volume increases, the risk of complications also increases. This is why dose volume parameters are important for parallel organs. One of the main risks is radiation pneumonitis, which is an inflammatory reaction of the lung tissue. Salivary glands are another example of parallel organs. They are highly sensitive to radiation, especially in head and neck treatments. Their function depends on how much of the gland is irradiated. If a large volume receives radiation, it can significantly reduce saliva production. This may lead to xerostomia, or dry mouth, which can affect speech, swallowing, and overall quality of life. So this is a good example where the main impact is not life-threatening, but it significantly affects quality of life. Deterministic effects can occur as both acute and late effects, depending on the tissue and dose. For example, inflammation may appear early, while fibrosis develops later. Stochastic effects, on the other hand, are typically late effects, often appearing years after exposure. The most important example is radiation-induced secondary cancer. Protection of organs at risk is a key objective in radiotherapy. During treatment planning, dose constraints are applied to limit the radiation received by these structures. Advanced techniques such as IMRT and VMAT allow better shaping of the dose around the tumor while sparing healthy tissue. In addition, accurate patient positioning and verification are essential to ensure the planned dose is delivered correctly. Protecting ORs starts in planning, but must be maintained during delivery. Organs at risk are normal tissues that must be protected during radiotherapy. Their response to radiation depends on both the dose and the type of organ. Serial and parallel organs behave differently, which influences how dose is evaluated. Exceeding tolerance doses can lead to significant complications. Therefore, protecting organs at risk is essential for safe and effective treatment. Here are the references. Thank you.